you are pregnant and you suddenly see blood in your underwear or in your toilet, instantly your mind goes to the worst case scenario. Am I aborting? Is my baby all right? Did I do something wrong? So bleeding during pregnancy does not always mean a miscarriage, but it is something you should not ignore. So hello everyone, I'm Dr. Anjali Kumar and I once again bring greetings to you from Maitri. Maitri is a space where we talk anything and everything about women's health. And before we begin to talk on this important topic, do not forget to subscribe to Maitri. We are so close to becoming a 1 million strong family. Also, do not forget to follow our pregnancy series for the complete pregnancy guide. So coming to today's topic, bleeding in pregnancy. So how common is bleeding in pregnancy? So bleeding in early pregnancy is actually quite common. In fact, 10 to 15% of women experience spotting or light bleeding, especially in the first 3 months, which is first 12 weeks. So why does the bleeding occur in pregnancy? Actually, there should be no bleeding in pregnancy. So let's understand what are the common causes of bleeding in the pregnancy. So the causes actually vary according to the different trimesters. So in first trimester, there's something called implantation bleeding. So in very early pregnancy, some women notice very slight spotting around the time the embryo attaches to the uterus. Now, this is called implantation bleeding. It's usually light pink or brown in color. It can last just for a day or two. It's not heavy like periods and typically settles on its own within 2 to 3 days. Then there's something called subchorionic bleeding. Now, this is also very common. Now, this is a small collection of blood which forms near the pregnancy sac inside the uterus. So that's the uterus. This is where the pregnancy is. Sometimes the lower part of the sac could separate and there could be bleeding here where the sac separates from the uterus. This can happen because a tiny part of the pregnancy lining separates slightly from the uterus. You may notice slight bleeding, sometimes with light discomfort and cramping. And in most cases, this settles on its own, might require you to take some rest, maybe progesterone supplements, and the pregnancy in all probability continues normal. Then, cervical erosion or cervical polyp. So what is a cervix? Now, cervix is the mouth of uterus. This is uterus, this is the cervix. Now, sometimes post-intercourse or maybe simply post a simple vaginal examination, there could be some bleeding from the cervix. Now, during pregnancy, the cervix becomes very vascular and can bleed upon touch. Now, some women have a raw area on the cervix. This is known as cervical erosion, or sometimes a very tiny, soft growth at the mouth of the uterus. This is called cervical polyp. Now, these might bleed on contact or they might just bleed on their own also. Now, this can look scary, but in most cases, this is not harmful, doesn't affect the pregnancy at all, and the pregnancy continues naturally. Then, miscarriage. Now, when a miscarriage is happening, it often follows a certain pattern. You may notice the bleeding starting to increase, is usually bright red in color, becomes heavier over time, and this is usually associated with some kind of severe cramping pain because the uterus is contracting to expel the pregnancy out. And in some cases, the person might notice some clots or passage of some fleshy tissue also coming from the vagina. Now, in this case, you must report to the doctor ASAP as soon as possible. Most important, miscarriages are extremely common and most of the time it is not because of something the mother did or the mother did not do. So please do watch our detailed video on why miscarriages happen. Then a very important cause of bleeding in early pregnancy is ectopic pregnancy. Now this is a very risky situation where the pregnancy develops outside the uterus. So that's the uterus, these are 2 tubes and these are 2 ovaries. So, in this case, the pregnancy, instead of developing inside the uterus, it develops outside, usually in the fallopian tubes. So, the tube, unlike the uterus, cannot expand when the pregnancy is growing and may actually burst inside the abdomen if it is not treated in time. So, in such cases, there's usually pain in the lower abdomen, usually on one side, depending upon which fallopian tube is involved, along with some bleeding. Sudden giddiness or fainting symptoms along with pain and bleeding could mean that there is bleeding inside the abdomen, and this is a medical emergency and needs immediate medical attention. As a doctor, missed period, pain abdomen, bleeding with giddiness. Rush to the doctor, rush to the hospital as soon as possible. Then coming to the causes of bleeding in the second and third trimester. The main reasons for bleeding at this time are the placental problems. So what is a placenta? Now, placenta is something which attaches the baby to the uterus. Now, sometimes the bleeding could be related to how the placenta is positioned inside the uterus. So normally the placenta is located at the top of the uterus. But in case the placenta is located lower than usual in the uterus, this condition is called placenta previa. Now, it could completely or partially cover the cervical opening. And the bleeding, which happens because of the low-lying placenta, is usually painless and can actually occur without any trigger, without any warning, even while you're just lying down. Now, in some cases, the placenta may be at a normal position, but it may begin to separate from the uterine wall earlier than it should. Now, this is called placental abruption, and this bleeding is usually associated with pain, cramps, and in both these cases, whether it is placenta previa bleeding or it is the placenta abruption bleeding, or there is any kind of bleeding in the later part of pregnancy, please rush to the hospital as soon as possible. Then there is something which is known as show before labor. So as you get closer to delivery, you notice a thick mucus-like discharge which is tinged with little blood. Now this is what we call as bloody show. Now this happens because the mucus plug which seals your cervix during pregnancy starts to come away as the cervix begins to soften and open to prepare for delivery. Now, there are tiny blood vessels in the cervix. They can break during this process, and that's why you see some blood mixed with mucus. It's called a show simply because it's a visible sign. Your body is showing that your labor is approaching. Now, this is absolutely a normal physiological process, especially when you are near your due date. However, in case you notice heavy bleeding instead of light mucus-like discharge, this could mean that your placenta is separating and you must report to the emergency as soon as possible. So what to do when you notice bleeding in pregnancy, whether it is first trimester or the later part of pregnancy? So if you notice bleeding, the first step is not to panic, but to observe. Is it just light spotting or is it heavy bleeding? What color it is? Brown, pink, bright red? Are you having some pain or cramping? These small details can help us as doctors understand what might be going on. Put a clean pad and report to the doctor as soon as possible. When should you seek help? Immediately, without waiting even for a minute. If the bleeding is heavy, if you have significant pain, and if you feel dizzy or unwell along with bleeding, please do not wait and get medical help immediately. So, bleeding during pregnancy can be very scary, but I hope this video helped you understand the possible reasons behind it. Remember, bleeding in pregnancy is not always dangerous, but it is something you should pay attention to and get evaluated at the earliest. If something doesn't feel right, trust that instinct and speak to your doctor. And if you still have questions or concerns on this topic, leave them in the comments below and I'll be happy to answer them. And once again, do not forget to like, share and subscribe to Maitri, and I will see you soon.